Your health insurance premium just went up 114%. That's not a scare number, that's the average increase subsidized Americans would be paying right now to keep the exact same ACA plan they had last year. If you're self-employed, retired early, or just buying your own plan instead of getting it through work, you already felt this hit your bank account. So today, I am ranking 10 countries by one simple question. Where would the same health insurance bill you're paying right now practically disappear? Stick around, because number 1 is the country where American retirees are telling us they pay less for a full year of healthcare than they used to pay in a single month back home. Let's start with number 10, Ecuador. Ecuador sits along the western spine of South America. In its highland capital, Quito, a city where colonial cathedrals share the skyline with modern private clinics, legal residents gain access to the public IESS healthcare system for a monthly contribution tied to income, typically landing between $70 and $90 a month, covering hospitalization, surgery, and specialist care in full. For those who want faster access or English-speaking doctors, a private supplemental plan in Quito or Guayaquil commonly runs $80 to $150 a month, and most of these plans come with zero waiting period for anyone under 65, which is almost unheard of back home. Dental care follows the same pattern. A routine cleaning or filling in Ecuador costs $20 to $40 out of pocket, compared to $150 or more at most US dental offices, even with insurance applied. Compare that to a US marketplace premium now averaging well over $600 a month for a 60-year-old post-subsidy, and you start to see why Ecuador quietly ranks as one of the most complete healthcare value destinations on the planet. Residency itself is relatively simple to obtain too. The popular route is a pensioner visa, requiring proof of at least $800 a month in fixed income, and once that's approved, IESS enrollment is automatic. What makes Ecuador truly distinctive is that it runs on the US dollar itself, so there's no exchange rate math standing between your budget and your peace of mind, and no currency devaluation that can quietly erode your healthcare savings the way it can in countries with their own printed currency. On top of that, prescription drugs in Ecuador are frequently 60 to 80% cheaper than US retail prices even without insurance. Since many common medications sold over the counter, they require a prescription and a markup back home. Number 9, Colombia. Colombia rises through the heart of South America as a nation of striking contrasts, where Caribbean beaches in the north give way to misty coffee highlands and the glass towers of Bogotá, earning it a reputation as the most underrated healthcare destination in the Americas. In Bogotá and in the eternal spring city of Medellín, legal residents enroll in the public EPS system for roughly $60 to $100 a month based on income, receiving coverage that includes specialist visits, surgery, and prescriptions with almost no out-of-pocket cost on top. Private supplemental coverage, favored by expats who want shorter wait times, typically adds another $50 to $120 a month, and unlike a lot of US supplemental plans, it usually comes with no separate network restrictions. You can see almost any specialist in the city without a referral chain first. What makes Colombia truly distinctive is that its private hospitals in Medellín are internationally accredited and draw medical tourists from across the hemisphere for everything from cardiac procedures to dental reconstruction, meaning residents are paying a fraction of a US premium for care that patients elsewhere fly in specifically to receive, often at a tenth of the surgical cost they'd pay stateside. Even outpatient specialist consultations, the kind that can run $200 to $400 out of pocket in the US, cost $30 to $50 in Colombia's private system without insurance at all. Number 8, Malaysia. Malaysia stretches across Southeast Asia as a nation where gleaming modern skylines meet ancient rainforests and turquoise coastlines, earning it the global title of Truly Asia for the diversity packed within its borders. In Kuala Lumpur, home to one of the most respected medical tourism industries on Earth, comprehensive private insurance for residents typically runs $100 to $250 a month, depending on age and coverage tier, and a standard doctor's visit or basic blood work frequently costs a tenth of the equivalent US price out of pocket. Malaysia's long-stay visa program, known as MM2H, has historically been the preferred route for retirees and remote workers alike, and while the financial requirements have tightened in recent years, the healthcare access on the other side of it remains some of the best value in the region. What makes Malaysia truly distinctive is that its hospitals aren't a discount alternative. They're the same JCI-accredited facilities that wealthy patients from the US and Europe fly in for elective surgery because the price-to-quality ratio simply doesn't exist anywhere at home. And Malaysian hospitals have consistently ranked among the top medical tourism destinations on Earth for over a decade running. Even a routine full-body health screening, the kind that can cost well over $1,000 in the US, typically runs $150 to $300 in Kuala Lumpur's private hospitals, with same-day results included. If this list is already changing how you think about your healthcare bill, drop a comment with the country you've picked so far. I read every one, and it helps me know which countries to dig deeper into next. Number 7. Costa Rica. Costa Rica curves through Central America as a nation of volcanic peaks, cloud forests, and 2 coastlines, earning it the global title of the land of pura vida for the unhurried, health-first way of life woven into daily culture there. Once you become a legal resident, you're enrolled in the CAHA, the National Public Healthcare System, with contributions based on income, typically landing between $50 and $150 a month, and covering doctor visits, hospital stays, and prescriptions, with no separate deductible. Many expats also carry a private supplemental plan for faster specialist access, usually adding $50 to $100 a month, and Costa Rica's Rentista and Pensionado visa categories both fold directly into CAHA enrollment the moment residency is approved, so there's no gap in coverage while paperwork processes. What makes Costa Rica truly distinctive is that its private hospitals in San Jose are consistently ranked among the best in Latin America, so residents aren't choosing between cheap and good, they're getting both at once, with wait times for specialist appointments in the private system often measured in days rather than the weeks or months common in the US. Even major procedures like knee replacements or cardiac bypass surgery routinely cost 70 to 80% less in San Jose's private hospitals than the equivalent surgery in the US, before insurance is even factored in. Number 6. Uruguay. Uruguay is a small, stable nation of rolling grassland and Atlantic coastline that rarely makes anyone's radar, earning it the unofficial title of South America's best-kept secret. Uruguay runs on a mutualista system, private non-profit health cooperatives that function almost like an all-inclusive membership, and monthly enrollment typically costs $80 to $150, covering most routine and emergency care under one flat fee, including things like physical therapy and mental health visits that often carry separate copays in the US. Residency in Uruguay is also comparatively straightforward, requiring only proof of income or savings rather than a large upfront investment, and mutualista enrollment can begin almost as soon as your residency application is filed, not after it's finalized. What makes Uruguay truly distinctive is its political and economic stability. This isn't a country where the healthcare system might change dramatically next election cycle, which is the kind of certainty your monthly ACA premium can no longer offer you, especially with plan networks and coverage terms shifting nearly every renewal period back home. Uruguay's mutualista clinics also operate their own pharmacies with member pricing built in, so a lot of routine prescriptions end up costing residents just a few dollars a month rather than the copay stacking Americans are used to. Number 5. Panama. Panama sits at the crossroads of the Americas, where global shipping crosses between 2 oceans through its legendary canal, earning it the global title of the Dubai of the Americas for the soaring skyline rising above its rainforest and beaches. Panama's Pensionado visa, built specifically for retirees with a qualifying pension, comes with built-in discounts of 10 to 20% off medical consultations and prescriptions, plus additional discounts on hospital stays that apply automatically at the point of billing, no paperwork required. Beyond that, private health insurance in Panama commonly runs $60 to $200 a month depending on age and coverage level, and most plans include emergency medical evacuation coverage as a standard inclusion rather than an expensive add-on. Panama's healthcare infrastructure also benefits from heavy foreign investment tied to the canal economy, which has funded newer hospital construction in the capital over the past decade than most comparably sized U.S. metro areas have seen in the same period. What makes Panama truly distinctive is that its capital hospitals are staffed with U.S.-trained doctors and built to U.S. standards. So you're not trading quality for price here, you're simply cutting out the insurance markup that inflates every American premium. while still keeping direct access to specialists trained at the same institutions as their US counterparts. Panama City's private hospitals also publish flat-rate pricing for common procedures in advance, so there's no surprise billing after the fact, something that still catches Americans off guard even with insurance back home. Number 4. Mexico. Mexico spans an entire continent's worth of landscape in a single country, from desert borderlands to jungle coastline to colonial mountain cities, earning it the global title of the most visited country in the Americas for a reason. Legal residents can enroll in the public IMSS system for a modest annual fee that often works out to under $50 a month, covering hospitalization and major procedures. Private insurance, favored by most American expats for its English-speaking staff and shorter waits, typically runs $100 to $300 a month, depending on age. Still a steep discount off a comparable US plan, and many private hospitals in Mexico also offer direct cash pay pricing for procedures. That's published upfront, something almost no US hospital does. What makes Mexico truly distinctive is its proximity. World-class hospitals in cities like Guadalajara and Mérida are a 2 to 4 hour flight from most of the US, meaning you can keep a US doctor as a backup without the premium price tag attached to it. And border cities like Tijuana have built entire medical districts specifically to serve Americans crossing over for dental work, prescriptions, and elective procedures at a fraction of stateside cost. Insulin and other chronic conditions medications, some of the most expensive line items on any American's monthly budget, are commonly available in Mexican pharmacies for a fraction of the US list price, with no prescription markup or insurance negotiation required. Number 3. Thailand. Thailand curves through Southeast Asia in a shape locals compare to an elephant's head, a nation of golden temples, tropical islands, and one of the most advanced private hospital networks anywhere in the world, earning it the global title of the Land of Smiles. Bangkok alone is home to hospital chains that treat more international patients each year than entire small countries, and private insurance for expats typically runs $80 to $200 a month depending on age, with routine visits and even major procedures costing a fraction of their US price out of pocket. Thailand's retirement visa route requires proof of savings or income and renews annually, and health insurance has become a mandatory component of that renewal for anyone over 50, which in practice just formalizes coverage most expats were already carrying anyway. Bangkok's private hospitals also run their own international patient departments, complete with translators and dedicated coordinators, so navigating a foreign healthcare system never actually feels foreign once you're inside it. What makes Thailand truly distinctive is scale. This isn't one good hospital in one good city. It's an entire national industry built around delivering world-class care at prices that make an American ACA premium look almost absurd by comparison, with private hospitals routinely offering same-day specialist consultations that would take weeks to schedule in most US cities. Dental work in particular has become a major draw, with full crowns, implants, and cosmetic dentistry costing a fifth of US prices at clinics that cater almost exclusively to foreign patients flying in for exactly that reason. Number 2. Spain. Spain stretches across the Iberian Peninsula as a nation of Mediterranean coastlines, ancient cities, and a public healthcare system that international rankings routinely place among the best on Earth, earning it the global title of one of the healthiest nations on the planet, with a life expectancy to match. Once you obtain legal residency, you gain access to the public system either directly or through a low-cost buy-in and private supplemental insurance. The option most expats choose for speed and English language service typically runs just $60 to $150 a month, regardless of age in many cases. A rarity in an industry that usually prices older residents out. Spain's non-lucrative visa, one of the most common paths for Americans, requires proof of financial means but comes with the added benefit of enrollment into both public coverage and the option of adding private coverage from day one, with no pre-existing condition exclusions in most standard plans. Mental health coverage in particular stands out. Therapy sessions that can run $150 to $250 out of pocket in the US typically cost $40 to $60 in Spain's private system, with many plans covering a set number of sessions per year outright. What makes Spain truly distinctive is that this isn't a developing world discount system, it's a first world EU standard healthcare system that happens to cost a quarter of what you're paying right now, backed by a hospital infrastructure that regularly outperforms the US in categories like preventive care access and hospital-acquired infection rates. Even childbirth, one of the most notoriously expensive line items on a US hospital bill, is either free or close to it under the public system and rarely exceeds a few $100s total, even for residents relying solely on private coverage. Number 1. Portugal. Portugal hugs the Atlantic edge of the Iberian Peninsula, a nation of sun-bleached coastal towns, terraced vineyards, and a capital, Lisbon, that has quietly become the top relocation destination for Americans anywhere in the world, earning it the global title of Europe's best value nation 2 years running. Legal residents gain access to the public Serviço Nacional de Saúde, and most expats pair it with a private plan that runs an almost unbelievable $30 to $80 a month for adults under 60, a number that sounds like a typo the first time you hear it, but is confirmed repeatedly by expats living there right now. Portugal's D7 visa, built around passive income rather than a large lump sum investment, has become the default entry point for Americans making this move, and private coverage can typically be arranged before residency is even finalized, so there's no coverage gap during the transition. What makes Portugal truly distinctive, and exactly why it takes the #1 spot, is that it delivers EU standard, first-world healthcare at a price point that isn't just cheaper than your ACA premium, it's cheaper than what most Americans pay for a single copay. In a country that also ranks among the safest and most stable nations in the European Union. Even for expats who skip private coverage entirely and rely solely on the public system, out-of-pocket costs for hospital stays and major procedures remain capped at levels that would be unthinkable on a US hospital bill, which is why so many Americans researching this move end up stopping their search right here. And that's it, my dear friends. I hope this list gave you a new perspective on healthcare costs around the world. Don't forget to hit the like button, subscribe to the channel, and turn on notifications so you don't miss our upcoming videos. See you in the next one.